Hey everybody, hope you're having a great week. And I just want to first off thank everyone for opening our emails. Our last week's email was the most opened email so far with almost 70% open rate. So I think that's great. I think the information in here can really help people. So if you knew somebody else who might benefit from whether it's like structural stuff or peptides or general information, just send it over to them and tell them to sign up. So it's been in the office here. I'm just about to go home for the week, but I don't want to leave without doing my shockwave. So this is kind of what it looks like for myself. Maybe you remember I treated my left carpal tunnel, and that one is not numb anymore, and my dexterity is getting better. So I'm moving on to the right because I had bilateral carpal tunnel, mostly from doing my work, and I've had a couple falls. So what it looks like is you go over the screen here, and I just pick carpal tunnel. It preloads the settings, and it goes down to the lowest setting, which is 0.5 bars, and it's going to do 1,000 shocks, and the frequency is 4. So I'm going to go ahead and hit play here, and as it starts, and I'm just treating myself, I'm going out where the median nerve is. That's the nerve that gets entrapped with carpal tunnel. And I'm going to follow that path. You'll start to encounter things that are painful or tender. You know that there's some adhesion damage, and also the nerve is very superficial there, like very close to the skin. And that's also the most common entrapment site that I've seen, at least. As I go through the carpal tunnel itself, it's not as painful as right above. So I'm going to go ahead and focus above, but I'll follow it all the way up. And last time I did it, this was all very tender. It's much better now. And it's now just focused distally through the wrist. And it's probably just due to the nature of my work. But because it supplies these fingers here and part of that one, I'm going to go ahead and hit the nerves and the muscles around the thumb as well. When the thumb degenerates, it gets very nasty and terrible and hard to treat. It's very uncomfortable because the thumb takes up a lot of space in our brain. So when it's painful, it's really painful, as some of you know. So the rundown for the week, it's been a short week due to snow and all that, but we've treated, these are new cases, we've treated 7 shoulders, which is pretty amazing, 2 hand conditions. We've got 3 plantar fasciitis. We've done a post-surgical knee. That's not a new one, but results have been pretty great for that. And 2 Achilles, separate from plantar fasciitis, just treating insertional Achilles problem. So if you know the Achilles tendon, it could be insertional or non-insertional. So insertional would be like right where it inserts into the calcaneus bone. Non-insertional would be above. Traditionally, insertional is very difficult to treat. It takes a long time. So this is really speeding things up for those people. We still are going to rehab it. We still need to strengthen up that tissue and all, but cutting down all that scar tissue and adhesion has been pretty great for that. So as I'm doing this, it's getting less and less painful in those areas that hurt. So I'll start to expand it a little bit more into the thumb. And what some people experience, what I described it as, it's almost like when you treat your arm, it feels like it's like high or medicated, after you do treatment there. And there's some hormones being released. Some happen quickly, like nitric oxide synthase, and some of them take time to build up. And the ones that take time to build up are the ones that involve with regrowing, injured tissue. So that's a little bit more of a short game, and then there's a long game involved with this. Anyway, I hope you enjoy the peptide information above. If you want to know more about it, you can shoot us a message back. Everyone who sent us a message last week, those peptides that we ordered for you are going to be in within a couple days or so. So we'll contact you.